Gallbladder cancer is by far the most important one. There are so many changes between AJCC's 7th and 8th edition, so it is very important to learn the staging. Some important concepts before going into staging are, let's see the layers. So the mucosa contains an epithelium layer and lamina propria. Muscularis mucosa is absent in gallbladder, and submucosa is also absent in gallbladder. So the next layer comes to muscularis propria, and then perimuscular connective tissue and serosa. Gallbladder is like this. So serosa is present only on the peritoneal side but not on the side adjacent to the liver. Here serosa is absent. So with this basic concepts in mind, let's see the T staging. T1 is invasion up to lamina propria. 1A and 1B is muscularis propria. T2 is perimuscular connective tissue. Which is again divided into 2A and 2B. 2A, if it is perimuscular connective tissue is present, it is invading perimuscular connective tissue on the peritoneal side. 2B, if the tumor is present on the adjacent to the liver. T3 is invasion into liver or single adjacent organ. As we can see here, once it has invaded the perimuscular connective tissue, the next will be going into the adjacent organs, or with perforation of serosa into the adjacent organs. The adjacent organs are either duodenum, stomach, transverse colon, etc., and or into the adjacent liver. So the important point to remember here is invasion into liver is not considered as metastasis. It's just T3. T4 is 2 or more adjacent organs. Or invasion of vascular structures. CBD, portal vein or hepatic artery. Before seeing the end staging, let's see the lymphatic drainage. So from the gallbladder, the lymph drains into cystic nodes around the cystic duct and into the pericholedochal nodes along the portal vein, CBD and hepatic artery. All these lymph nodes are involved. It is a descending type of lymph node, but there is no ascending lymphatics. That is the most important point. It does not ascend upwards into the porta hepatis. Then retroportal nodes are involved. Then posterior pancreatico-duodenal nodes are involved, and from there into the superior mesenteric nodes and interaortocaval nodes are involved. So coming to the end staging, it is N1 and N2. Involvement of regional lymph nodes. N1 is 1. It is just divided based on the number, not on the slide. 4 or more are considered as N2. N0 is no metastasis, and 1 is present of distant metastasis. So Tx is when the primary tumor cannot be assessed. T0 is no evidence of primary tumor. TIS is carcinoma in situ. T1A is invasion into lamina propria. T1B is muscle layer. T2 is invasion into perimuscular connective tissue without involvement of serosa or liver on peritoneal side and on hepatic side. So this is peritoneal side and this is hepatic side. T3 is perforation of serosa, direct invasion into liver or one adjacent organ, which could be stomach, duodenum, colon, pancreas, omentum, or extrahepatic bile ducts. T4 is invasion into main portal vein, hepatic artery, or two or more extrahepatic organs. And is divided into N1 and N2, 1 to 3 regional lymph nodes and 4 or more regional lymph nodes. M1 is presence of distant metastasis.